show or even witness an individual claiming that aliens are after them or that they see something? Okay, so according to William Carpenter Jr., MD, schizophrenia is a mental illness that affects how a person behaves and thinks. They imagine things that are not real, and that affects their way of living, and they can harm themselves or others. Many people confuse this illness with split personality disorder, but it's not the same because schizophrenia is more severe. Through my speech, I want you to learn the disorder effects and how it affects individuals and the method of treatments that are used. In my speech, I will be talking about probable causes, symptoms, and treatments. So there is no exact cause of schizophrenia, according to the National Alliance of Mental Illness. But if a parent were to have the disorder, it's there's a 40% chance their child will too. But if both parents have schizophrenia, it's a much higher chance. If siblings do get the disorder, there is also an 80% chance their brother or sister will too. There has been twin studies where twins are separated, and if one gets the disorder, it's a 100% chance the other one will too, whether they're living together or not. Environment has a lot to do with this. They may not have the gene to get schizophrenia, but if they're with parents that do have schizophrenia, but they're not like their biological parents, they can get it too. Okay, so there are 3 different categories to symptoms: positive, negative, and cognitive. Positive symptoms are behaviors where individuals suffer from delusions, such as, let's just say, there's a patient in the hospital, and if they see cameras, they might think someone's after them or they're trying to do something to them. And they suffer from hallucinations where they can hear voices or see things that are not there. Negative symptoms are based more on emotions and attitudes. Their amygdala, which is part of the brain where hunger, fear, and lust is there. It's smaller than a regular person's brain, so that affects it, and they have no emotion whatsoever. So, and cognitive symptoms are more brain direct, such as it's difficult for them to speak and regain information that they had, or even focus. There are treatments, but it cannot be cured, such as, according to Rana Parek, MD, suggests that they can be controlled with antipsychotic drugs such as pills, and injections, but they do have major side effects, so it's kind of like can't really be cured. Just like they'll have less hallucinations and less delusions. The other one is therapy. Like they can have group therapies, but it really just depends on the person. Like if they don't feel comfortable with group therapies, they can have like a one-on-one with the psychologist. And this is one of the hardest mental illnesses to live with, and it should be taken seriously. In my speech, I explained the causes of the illness, talked about the symptoms, and explained the treatments. Through my speech, I hope you gained the information and realized how important this is. It may sound silly if someone told you that they see or hear like aliens, but just because you don't hear it doesn't mean they